Hello, good evening. How you day? Welcome again to another session of Ask the Doctors. Today is the 13th day of August 2023 and the time now 8 p.m. On this page, we dey do medicals, we dey teach, we dey answer questions. And today's topic, we dey talk about antibiotics and blood tonic. My name na Frederick Unigbohai, and I did privilege to be the host of this program. My co-host, Dr. Israel, will soon join us on the program. Now, for this page, I noticed say some people they try ask us for medications for treatment. Sorry, we know the treat. In case you do watch this video after we don't end here, we know the treat. But if you they hear me right now, you can hear me. Tell me where you did watch me from. Happy Sunday. How you did? Oh yeah, let's go. I did stream live on Facebook and YouTube. Femi, Femi Stone. Good evening. Watching from Lagos. Femi, how far now? How your side? Okay. So the rest people where they watch me, tell me where you they watch me from. How has been your day? How has been your week? Yes, yes, yes. So we want to talk about antibiotics and blood tonic. I hope say Dr. Israel will join us today and maybe we talk about them. If you do watch me on whatever platform, I beg, share this live, invite your friends, make them come and learn. Now, people they abuse antibiotics too much. Forgive me, say I dey speak pidgin English. For this page, we dey try to make the health education as basic as simple, and we dey use pidgin, mostly pidgin. Now the brand for this page. That does not mean that we can't speak English, but because of what we want to do on social media, we decided to speak pidgin English. So no vex, yeah. So people they abuse antibiotics well, and it dey cause a whole lot of problems. And then after abusing antibiotics, they go on to take blood tonic. You know, when we go here, they go talk, say, doctor, you give me antibiotics, but you know add blood tonic. And when you ask them why did they ask for blood tonic, you hear things like should be antibiotics, they dry blood. Then talk say antibiotics, they dry my blood. So I want blood tonic so that I mean my blood will finish. I don't really know where that thing come from. So today, make we talk about them. Make we break them down. Who do we have here? Ikechukwu from Anambra. Chukwuebuka Alpha. Happy Sunday. Okay. Now I get something where I need to talk quickly. I hope say people will go watch this video, go see this one. I beg. We know they do private chats. We know they do private chats. We know they give out number on social media. Yeah, in case you did hear. So antibiotics na medicine. Number one, na medicine. Now, this medicine na to fight bacterial infection. You dey hear me so? One, na medicine. This medicine na to fight infection. Which type of infection? Bacterial infection. Now we dey use antibiotics for. Dr. Israel is in the house. Do you understand? So I want to make you get the picture now. Dr. Israel, how far? How you? Hello.
I'm fine. Good evening.
Evening. Welcome everybody. I hope say not be only me, but hope you can hear me, right? Oh my god. Okay. Sorry, your network they act funny. Try fix them, then join us again. Okay. So we talk about antibiotics. Antibiotics, Good evening. Na medicine. This medicine we dey use take treat people wey get bacterial infection. Shey you understand? Okay. But people dey abuse antibiotics well well, and whenever they go clinic, they go hospital, doctor give them antibiotics, you go dey hear, but why you no add blood tonic for me? Why you no give me blood tonic? So I no really know where that discussion come from. And we don dey pass am from one generation to another generation, say antibiotics dey dry blood. Now we get so many types of bacterial infection. Listen carefully, oh. We get plenty types of bacterial infection, number one. Number two, we get plenty types of antibiotics also. Plenty types of bacteria dey. And this Dr. Israel, how far? Can you hear me now?
Yeah, I can hear you. Can you hear me?
Good. Though your network is acting, it's still acting up. It's still acting up. I don't know.
Hello, can you hear me?
No. Your network is poor. Some people can't hear you. The network is poor. Yep. Okay. So, like I was saying, many type of infection dey wey bacteria dey cause. Infection for your skin, infection for your blood infection, infection for the bone, infection for the stomach, infection for the private parts. So many types of infection dey wey bacteria dey cause. And you notice something, when somebody just feels somehow, the next thing, e don go run buy antibiotics, not even knowing whether na the right medicine e dey collect or be na the right diagnosis e get. That is number one. So we get plenty types of antibiotics. And these antibiotics, when we use them at the right time, for the right condition, cure the day, person dey fine. But we don't realize, say, some antibiotics too no dey work again. You know why? A lot of people don dey drink antibiotics like say na pure water. So most of these antibiotics no dey work. That is number one. So you go see somebody every time go talk, say, doctor, I dey treat infection, I dey treat infection. Maybe the antibiotics wey you dey use sef no dey work again for your body because you don abuse antibiotics, or you dey treat the wrong disease, or you dey take the wrong medicine. Now one thing wey dey surprise me be say people dey waka for social media, dey look for medicine, dey look for antibiotics on social media, not knowing that social media no be hospital, and there is no way you can treat yourself on social media. No be say I dey try to make you fear. But if you want to treat yourself from whatever infection, you need to have a one-on-one discussion with a doctor, because I dey see things on this online, fear dey catch me. Now let's go to the next one. You know, say some people fit take antibiotics and the antibiotics go give them problem. So we get some kind side effects for antibiotics. You get how you go use antibiotics, Yes. Okay, I see you on YouTube. Yes, I see you. Adeniyi, I see you. You get how you go use antibiotics, it will give you problem. If it give you abdominal pain, if it give you skin rash, yes. And if it give you even vomiting, you understand? But most of the common antibiotics wey we get, they no dey really give us problem like that. And now for few cases, these antibiotics actually they cause problem for some people body. Few. So before you take any antibiotics, it get some things where you need to follow. And that is why I dey beg you. I don't know if you don't dey follow me, they come since, so I be new follower. We go tell you, say, you go need to get a discussion with a doctor. Get a doctor. Wey be say whenever you get any problem like this, you go fit follow that doctor talk one-on-one. We go fit guide you, because a lot of people don't become doctor for themselves. Your body dey do you one kind. You think say you go just sit down, you go know the kind medicine to drink. Never. No be say I dey try make you fear. Never. This is why we have doctors. Be like your motor spoil. You are not an engineer. You're not a mechanic. You can't go they read how to repair car. You go spoil the car now. Do you understand? Good. Now, when your doctor prescribe antibiotics for you, they go tell you, say, take them for 5 days, take them for 7 days, take them for 2 weeks. But wetin we notice be say some people, the moment they start the antibiotics and their body just dey fine small, they don't stop. They don't stop the antibiotics, not knowing that the whatever way they treat, whatever sickness, whatever condition way they treat, it still dey the body. They will can't stop. Then later on, when they need that antibiotics again, or that problem come back, you drink the medicine, it no go work. I don't know if we get new followers on the page. If you just follow us on this page for the very first time, you do welcome. We appreciate you for joining us. We are very happy to have you here. But on this page, majorly, not teach, we teach, and we advise. We don't actually do medical prescriptions. We don't make diagnosis online. Do you understand? Yeah. So we're happy to have you here. And 80 to 90% of our teaching are in Pidgin English. There's a reason for that. That is actually the brand to make us different from others. So no vex. In case you know they understand Pidgin, no vex. Yeah, I beg. Good. Now, when doctor tell you take this medicine for 1 week, you will take them for 3 days, 4 days, and then when you feel okay, you stop, not knowing that this medicine never work finish. Gradually, they build resistance, antibiotic resistance. And then tomorrow, when you need the same medicine again, it no go work. You dey follow me? You dey hear me? If you dey follow me, you dey hear me, you dey understand. Put them in the comment section. I dey follow you. I don't understand. Now, there is another very big problem. You get some antibiotics where our people, they abuse well. They abuse antibiotics. Remember, antibiotics now medicine for treating bacterial infection. I repeat, bacterial infection. We get different types of infection. We get viral infection, we get fungal infection, we get parasitic infections. You understand? So antibiotics now for bacterial infection. And it gets some antibiotics where our people they abuse too much. Like somebody listening to me right now, you where they watch me for your house, you get flagyl, you get amoxicillin, you get ciprofloxacin, you get augmentin, you get all the antibiotics for your house. Whereas you no be doctor, you no be pharmacist, you no be nurse. Chai. No, how you no go get problem? No be say they wish you bad thing. I know they wish you bad thing. No, I'm not. Trust me. But how do you think that all those medicine where you pack put for your house no fit give you problem? You hear me, so Abi? Good. And then you go see some ladies. This is common with ladies. Any small abdominal pain, antibiotics. Any small rash, antibiotics. And then you go dey complain, I dey get PID, I dey get toilet infection, I dey get this and this and this. Whereas maybe no be those things, you don't get them. Now just because of I too know, you feel you know too much, and you dey give yourself more problems. Now, may we go another area. Blood tonic. Whenever your doctor give you antibiotics, you will come dey vex. Doctor, why you no give me blood tonic? And doctor will tell you, you don't need blood tonic. And then you will tell and say, doctor, but my blood they dry. The antibiotics they dry my blood. Number one, the first thing I want to tell you right now, antibiotics no they dry blood. Dr. Israel, how you dey?
Fine. Good evening. You dey hear me?
Now I dey hear you. Welcome. How your side?
Fine. Happy Sunday to everybody.
Yes. Happy Sunday. Welcome. Okay. So before Dr. Israel join us, we don't talk about antibiotics, many things about antibiotics. So what we go do so that make we no repeat because of time. I don't discuss antibiotics. Then if you get questions on antibiotics, as we take your questions, Dr. Israel go address that one. So I want to start the other part of the discussion, antibiotics and blood tonic. I repeat, antibiotics and blood tonic. So many patients don't go hospital, don't go follow their doctors fights. They don't drag doctor for shirts. They go pharmacy, give me antibiotics, you must give me blood tonic because they dry my blood. Number one, they dry your blood. They dry blood. Blood tonic, now like blood supplements. Now another form of medicine wey we dey prescribe to patients when they get anemia, when their blood dey low, when they get iron deficiency anemia or vitamin B12 anemia. You understand? We dey give them, make their body produce blood. But some of our people believe say antibiotics, whenever they take antibiotics, they must take blood tonic. It is wrong and it is false. You dey hear me so? Blood tonic na just to use and produce blood when your blood don't go down to make am up. Then some cases go dey, your doctor go talk say, as I dey give you these antibiotics, I also want add blood tonic. Why? Your blood is low. No be say na because of the antibiotics, now they make your doctor they add the blood tonic. Your doctor is adding that blood tonic or blood capsule or whatever you call them because you don't realize say you get blood shortage. You dey hear me so? Dr. Israel, please,
Yeah.
so let's continue from the area of the blood tonic, and then maybe later as we answer questions, we go back to the antibiotics because of time. Sure, you get make we not to break them down. So just help us again from what I don't talk about the blood tonic. Any other thing where you feel say if we add on top, you just add on top. Yeah.
Okay. Dr. Fredo, you already talk one of the reason why, in fact, the major reason why our doctors they give us blood medicine. So we know the doctors know the carry they give blood medicine because now one medicine where they hospital when they need to sell or when they need to give patient maybe they forget money. No. So they just that if only that one are only when they notice say yes, this person blood they low. So they go give them blood tonic, join am so that it go increase their blood. And sometimes you go even notice say sometimes they'll tell you say not take am in a particular time, maybe after you don't treat yourself, finish for whatever thing you treat yourself before you go take the blood tonic. So that it go, because they believe say once you take the blood tonic, join the drug where you take, if the disease they very overwhelming, even the blood where you try to build, you go see it go still finish all those blood. So they go say, okay, when you don't treat yourself finish, then they go give you blood tonic. Yeah, there are some infection where be say now the infection na if it can't dry the blood, na if it can't cause problem for the blood, not be antibiotics, not be the antibiotics when they give you. So when that infection, when they say they overwhelming, don't date the body for a long time, the person only sick critically to the extent say they can't admit the patient for long for bed. So when that time don't reach, sometimes when they don't they go house, because when you check their blood level that time, because of the time when they don't spend for hospital and because the white blood cell where they their body don't help them many work. So they go don't lost some of those blood. So they will need to give them that blood tonic to just help them build up their the blood. And also they go sit there and so that made other things when they go to do, even though they not take the blood medicine. So blood medicine is just like supplement, like every other supplement where would they take. It's just to help to boost waiting already first day there. You not really get you not really obviously now anyone can heal you from the disease when you get or cure you. Yes, it will only help you to make sure say the blood level when they your body it can increase to some extent. So that are just a few things when I think say I will add join and make us also be very careful. Not be every time or every sickness where person get, not being they take blood tonic. Get some sickness when you person go get, will not go one give a blood tonic because the blood tonic pick up will lead to something else for the person body. So sometimes we go see they very skeptical when it come to giving blood tonic. Or when we look the constituent when they the blood medicine when you want take. Sometimes we people tell you say make you not take this particular one, make you not take this particular one because of some other things we would say if it happen when you take them. But all the same, blood tonic is just for us to help That is the main function, just to help to build or to increase the number of blood when they person body, and so that if person they lose blood small, make the blood for still go up to some extent. And that are just the major thing. And some people when they quick give blood tonic, and women when they see their menstrual flow, sometimes when they give them blood medicine, say okay, maybe they just take because of the blood when they don't lost, so that they go replenish, and for mostly for those one when not the two eat, or we not get time to eat. So we just give them those ones to take replenish the blood. Or you they see your blood, you they see messes, and the blood when you they lose, it did very much. So those are the person. Or if you are in an accident, now the person gets when can lost blood. After we don't do all the treatment, give every other thing, if you can add blood medicine, join us, so that and that blood medicine will PC help and increase the blood where they body, and also help to make healing day a bit faster. So antibiotics and blood tonic, they not really get one thing when you want put together. Say if you take antibiotics, you must take blood tonic. Not be true. It's not a compulsory. It's not a compulsory fact. You must not take blood tonic when you take antibiotics, because you think say the antibiotics they do one thing for the body, when the blood tonic will come help replenish. No, not be truth. And as Dr. Fred talk, the reason why your doctor will give you blood tonic, and because when you check your blood level for the body, that is when you check the PCV, pack cell volume, or full blood count, they find out say this blood cell for your body, it don't they reduce, it don't look past the normal. So it go, because when the blood cell even low past the normal, if it make the sickness worse, if it even make the antibiotics where you they take not work well. So because of that, they can't just give blood medicine. So if you not do blood test, and we not get any reason to think say you lose blood, your face not white, your hand not the white, you are not paid, you are not, and there's no need there when you go take blood tonic. You just need to eat good food, because with food, all those things go see if you pump for the body.
Thank you, Dr. Israel. If you just dey come, you dey welcome. We dey talk about antibiotics and blood tonic. Before we continue, thank you to Ike Nora Uche for sending us 50 stars. I see the star. Thank you. For those who dey come, welcome. If you want to help us, share this live and invite your friends. Share this video. Make other people, your friends, make them come learn. Make them know they suffer in ignorance. Thank you very much. Now, we go soon take your questions. If you get questions for us on this topic, ask us. We go break them down for you. That is the reason why we do online. This program now 8 p.m. to 9 p.m. every Sunday, 1 hour. We know they start African time. We start on this time on the dots. When it's 9, we they round up. Sure you get every Sunday. We they try keep the time. Now, Dr. Israel don't tell us a lot about blood tonic. It is not compulsory. Say anytime they give you antibiotics, you must use blood tonic. No. Now ignorance, now misunderstanding, misconception, misinformation. Now make people they believe say whenever they take antibiotics, they must. I'm using the word must. No, it is wrong. Some people don't even take blood tonic, don't come give themselves problem. Get what we call iron overload. Iron overload inside people body. At least they don't go take blood tonic too much. Inside that blood tonic, they don't get more problems. So this is one reason why it is important. Say you they need to follow your doctor, they talk. You get a medical professional where you they follow relate, may they guide you. May you not go use your own hand, spoil your body by yourself. You understand, Abby? Very good. So if you get questions for us on this topic where we don't talk now, drop them in the comment section. We will try answer you. But don't forget, share the video, click on the like button. Share the video, click on the like button, and invite your friends. Make them come learn. Imagine say we they give this kind of free information. No, tomorrow now, people go dey vex, say I dey sick, this and this and this and this. Come and get free knowledge. So back again from the very beginning, antibiotics no be for viral infection. You get some infection wey we dey call viral infection, like your common cold, cold and catarrh. Most times na viruses dey cause am. But some people go dey drink antibiotics, not knowing that that antibiotics true e fit no do anything for the person body. You understand? So antibiotics majorly na for bacterial infection, and we get many types of bacterial infection. We get the one wey dey cause vomiting and diarrhea. We get the one wey dey cause severe skin infection like cellulitis. We get the one wey dey affect bone, osteomyelitis. We get the ones wey dey even affect the eyes, wey dey affect the blockus, or wey dey affect pecus, wey dey affect so many parts of the body, the intestines, the kidneys, like that. So you go need a medical professional to guide you, to tell you, say, see, now this medicine you need after you don't do all these tests. It clear, abi no clear? Oh yeah, tell us. And then if you get questions for us, ask us now. So, doctor, can antibiotic be taken at the same time with blood tonic? Dr. Israel, please help us.
Yeah, based on what we don't talk, if you notice, we actually not tell you say this one at the time when you must take on, this one not be the time when you must take on. So if your doctor notice say your blood is low, even though you dey take antibiotics, he can actually tell you to take blood tonic at the same time, just to make sure say it build that your blood level go up. Mostly if you know say that blood when low, not be the one where they'll say they want to give you blood. So you just want to build that blood go back. So as at that time you feel they take your antibiotics, you not get there's no problem. Oh, what we just try to talk, say it's not compulsory. Say anytime you take antibiotics, you must take blood tonic. Yes, conditions they maybe say you fit take the two together. While there are some times when they'll say, okay, first finish one before you take the other one. Now it now depend on what did the doctor say. When he see you as a patient, before he go know whether you go take the antibiotics and the blood tonic together, or whether you go say, okay, wait after you don't finish the antibiotics, then you can start the blood tonic. Or if you go say no need for a blood tonic, just take your antibiotics, go to eat good food, and you will be fine. So yes, you can actually take it together, but not on all conditions.
Okay, thank you very much, Dr. Israel. If you get questions for us on this topic, I beg you, ask us here. Yeah, we know they do private chats for social media. Okay, we get another question here. Good evening from Olorun Tola Abayomi. If there is resistance of antibiotics, what is the next thing to do? Dr. Israel, you want to respond?
And the first thing, what did they really cause resistance to antibiotics? Now, when we don't take the right antibiotics for the right case, or when it be say we not take the right dose, or when we take even though we take the right dose, but we not take them for the right duration. Maybe they say take them for 1 week, you go take them for 3 days because you don't they get better. So when you don't they accumulate, you can lead to resistance. So in the case when resistance don't dey, the next thing you need to do is for you to go do tests. You notice say this drug when I take, it not green work. You go do tests, because sometimes you just need to know which bacteria really they cause the problem. And when you go do tests, when they call MCS, that one will tell us the bacteria when they there, and go tell us the drug when go work for that bacteria. The one because many drug fit dey will be antibiotics, but not be all these antibiotics they work for the same bacteria. So bacteria A fit get antibiotics will go work for them, and that antibiotics not go work for bacteria B, because bacteria B don't get power, they resistance to that antibiotic. So when you do that test to check which of the antibiotics go work, then you will not need to go change the medication, the antibiotics where they take, to the new one will go work for you. So now that what they do. Sometimes they see some people when they don't take antibiotics, in fact they don't go buy the one way they very expensive, they don't take it not work. When they do test, you can find out say the one where they're supposed to take now just the one where they're supposed to buy very cheap. then they will not go back and go and buy that one before everything will just work for them. So antibiotics many for what? Antibiotics many. So enough for us to do tests so that we can know the right one to take, so that we will avoid antibiotics resistance.
Thank you, Dr. Israel. I beg now, help us share the video, share this live session, and comment shared. If you don't share them, just comment shared. You get why? We want me you share, because you they share, you they help us let more people see them for your page. So click on share, and when you don't share them, comment shared. If you get questions for us, I beg. Ask him. It says, if test was done, but all the antibiotic on the result show resistance, what is the solution?
The funny thing is that I first tell you something to say antibiotics many for life. Antibiotics they many. So most of the time, most tests when they do not go fish give you resistance to all antibiotics. And that's the funny thing. It just be say the antibiotics when they show resistance to now the one when the people get when they test, now they show you. Because there are so many antibiotics. So it cannot be 100% possible to say it will just be resistance to every antibiotics. So there must always be one. In some cases, if people say they'll tell you, say, the resistance to this is low, the resistance to this is high. If it can't be say, okay, if it can't be say all the one we will check, all of them will see say that they resistance to it. Then we'll look at the one where we say it still gets more power. It still gets more power to take handle and small. So with that one, they go add some things during that one to see how we go fit handle the case. But as I earlier said, possible say they no go see anyone wey go work for that this thing. So if you go do test and they say all of them dey resistant, just know say na only that antibiotics now all those people get. Now make them say they resistant to all those ones. If you go another lab, they'll still show you another antibiotics, because antibiotics many for what.
Thank you, Dr. Israel. And if I may add to that, after you don't do your test, most times the doctor will tell you, say, okay, we did not test it, they resistant to these ones. We get so many antibiotics way they know they do for the MCS test. So many, and some they very expensive. So if they discover, say, the common ones, the person they resistant to, the doctor will advise the patient, now this condition, if not critical one, no, let's go higher to those rare, those expensive ones wey no too dey common. Do you understand? And they will give the patient. But wetin we realize be say a patient too go just feel sick, go carry himself, go lab, go do test, go come discover say e dey resistant. So if you notice like that, please discuss with your doctor. Now wey this thing don resistant, anyone no dey, they go tell you many dey o, many antibiotics dey, and some can be very expensive. When I say expensive, I mean very. This is why we dey advise people no dey take antibiotics wey you no need unless doctor advise you to do so. You are just coming. Wetin be your name? Chukwuna Christabel. You just dey come. You no follow us from the beginning. Does antibiotics reduce blood volume in the body? The answer is no. Capital no. That makes many drugstores sell blood tonic along with it. I repeat, wetin we don talk in the beginning. The answer na no. Drugstores wey dey sell antibiotics and blood tonic no be hospital. No doctor go just dey prescribe antibiotics for you with blood tonic anyhow. If a medical doctor give you antibiotics and they give you blood tonic, e get why. You don look the patient dey clinically pale, or you don do test, the patient get low blood, e add am. But wetin we realize for outside, for store, pharmacy, or some chemist, let me use the word chemist, they just dey sell rubbish. Number one, because they will make money. So they sell whatever they want to sell to you, and they lie to you, telling you that they must add blood tonic because the antibiotics, they dry the blood. Na lie. Na lie. Na lie.
That one
Okay.
are just market strategy. That
Now
are just
market.
market strategy because they want said most of their blood tonic. You notice most drugstores they get different type of blood tonic, different type. So when they never sell some particular one for a very long time, and you when you just come when don't know anything for a bad drug, they go want use that opportunity to sell their medicine for you. And that's what they do. And just to sell drug, not be say it they cause any reduction in blood volume.
Okay. I beg if you ask us any question, we know they related to today's topic. We no go talk about them. Yeah. I beg. We no go discuss. We no go discuss any question. We know they related to the topic, so that make you no carry us go where we don't know. Maybe they on top our topic today. And the topic for today, now antibiotics and blood tonic. So if you get questions for this one, ask us now. Feel free, ask us as much as you want to ask us, we go answer you. But if you carry us go another area, no vex. We no go comment on the questions. Not be say we no want talk because we no want deviate from the discussion today. Um, let's see. Any other questions? Ask now. Ask. Drop the comment here. No private chat. Good evening. Welcome. No private chat. Please use this opportunity to ask us your questions, and we hope that we'll be able to respond to you. Remember, we know they prescribe medications here now to just teach and educate you. Okay. I hope we don't break them down because it looks like some people no one just ask us within your mind. You no one change them. No problem. See some people don't go drink blood tonic and then get things like cancer. They can't go they drink blood tonic. Can't go they feed the cancer more. This is why it go good. Say before you begin to take anyhow blood tonic, discuss with your doctor. So Israel, you want to add anything again?
You don't talk not just any blood tonic. Before you take any drug at all, you need to discuss with your doctor. Even before you do any test, you need to discuss with your doctor. Few days ago, I seen one patient when go do abdominal scan. He go do the scan. He call me. Not be me send am. He bring the result. Come give me say make I help and make I check am. The first question when I ask am na who send you? He say nobody. Okay, why you go do the scan? He say because he no dey see him measles again. I say okay, so you no dey see your measles. Who come tell you say na scan now you need to go do? Why not go hospital so that they go ask you questions? Go see doctor wey specialize in women. They go ask you question. One of these two things, and before you know, maybe the solution will come out. I been not want to look the scan after making up like say person come see you for hospital, but because wetin come now for another thing. Now you just carry this to look at. The scan was normal. It was a normal scan, so it was not having any problem in terms of doing scan. I say you see why when they talk say mukuna they see doctors. If maybe you see doctors, maybe the doctor for never tell you may you do scan. Maybe the doctor would have sent you to do other investigation. And maybe when you do all those investigations, the result for don't come out. She called the look. And I said, now, if you go meet doctor now, doctor will say you may go do other tests. And now you don't already fair waste one particular money. So why they talk this and I will say, don't go buy drug, don't go do tests on your own, go buy different medication on your own without doctor telling you to buy it. The time you still go meet doctor, the doctor will still tell you, may you still go do some particular test and you go just surprise say you go different from the one when you don't first, and then you go spend double money. So make we dey careful both buying antibiotics, buying blood medicine, or buying any other drug because now we don't dey cause resistance to so many drugs with our own hand. Then we'll cause it by ourselves. They thought say this drug not they work, and but now we by ourselves. So if you buy drug and the doctor say take am for 5 days, I beg try take am for 5 days. No, not take am for 3 days, leave am. And not abeg which they talk, not just go pharmacy or chemist most of the time. Because chemist una dey quick go. Now chemist some persons dey quick go buy drug.
Okay. Please read my message. We know they see your message. What be your name? Chukwuebuka. We know see your message. Yeah. Send your message again. We know they see your message. We have a question here. What does it really do in the body? I mean, antibiotics.
So antibiotics, what they do for body, they help us to fight any bacteria when enter the body, when not supposed to the body. Bacteria. There are different things where they cause infection for body. If it be bacteria, if it be fungi, if it be virus, if it be parasite. So antibiotics, or yes, antibiotics itself now for bacteria. So if you go take them for virus infection, it not go work. So now only bacteria causing infection, now antibiotics go work for. So what antibiotics they do for our body, now be say they help the white blood cell, they join them, they fight against the infection when bacteria cause for our body. It go help them fight and kill them, or help them fight and make them dey powerless, so that the white blood cell wey dey our body go come fit kill them. Then we go come dey well. Na that one they do for us.
We have one more question. After personal lab visit due to fever, malaria was discovered. Why do chemist attendants give anti-malarial, antibiotics, and blood tonic? Is it proper to take antibiotics alongside anti-malaria?
Okay, say for this part of the world, or yes, this part of the world, most for those who they watch for Nigeria, now they talk to now. For those of us where they watch for Nigeria, say for Nigeria, most of us believe say once you get malaria, you get typhoid. So everything typhoid and malaria, typhoid and malaria. So even the chemist doesn't get them for it. Say once anybody come buy malaria drug, you must add antibiotics journal. You go now, you go even tell you say now typhoid and malaria, and typhoid and malaria. So now that one make them they do that. However, not be the right thing. It's not correct. You are never supposed to do that. You supposed treat waiting you get. Waiting the test talk say now the person get, now the person supposed treat. If the test say you get malaria, you treat malaria, you take anti-malaria medication, and you are fine, because you not get waiting the antibiotic for you. If the test say you get maybe you do test the correct typhoid test, and because say you get typhoid when they caused by salmonella, then you can take antibiotics so that it will work to kill the salmonella or any other bacterial infection. However, I get some particular antibiotics where they take as adjuvant. When we say adjuvant, so we they take as addition to malaria. There are very few, not be every antibiotic, so not be the one with the go bell. These are very few. Why did they take all those ones? Because they get small anti-malaria power. They find out say all those antibiotics, there are very few of them, they see they help they fight malaria. So now make sometimes when they give you the anti-malaria, some doctors, not be chemist people where they talk now, some doctors go add that particular antibiotics journal just to help you, and because it gets more anti-malaria power, but not be all antibiotics. And that one doctor and I go do, and not be chemist person. Because a chemist person do, and not be that sense when I talk, not be make and do. In you now, because it thinks say you get typhoid. So I think I will stop for there.
Okay, so may I just add one thing? You say after personal lab visit due to fever. If you dey follow us for this page, you go realize say we don't make video talk about fever. Our people go just get fever, next thing they don't run go lab. And when you enter run go lab, they go surely pick malaria for your body, because a lot of people get the parasite for their body, yet they no still get malaria. Do you understand? So when you get problem like this, you just run go lab because you want me to do test. They go surely see malaria. And when they see malaria, like we talked before, they go pack anti-malaria, antibiotics, everything joined together, hoping say one of them, one go work for you, which is quite wrong. Okay, we'll go soon round up. We have a comment here. My doctor tells me to take it only 7 days and after then throw it away. Is it normal?
Take waiting for 7 days.
I want to believe maybe
Waiting
not
your
the antibiotics. During that time, let's see. During that, I asked me to put it in the fridge. I want to believe you're talking about antibiotics. Is that it?
Okay, I think it's antibiotics because a first question now, what does it really do in the body? I mean antibiotics. So I believe it's still the antibiotics she's talking about. Yes, if your doctor say take am for 7 days, because you know say within after that 7 days, the job when the drug want to, e don do am finish. Na make e say take am for 7 days. For him to say throw the remaining one away, I don't know why he says so. Maybe because he not trust you. Maybe he believes say because after the 7 days, anytime when you go get the same, maybe you get some symptom like that, you go carry that one they take again, and he no want make you do such thing. Then maybe that's the reason he said throw it away. However, normally when he say take am for 7 days, because he know say within that 7 days you will be fine with the antibiotics when he give you. Now make it say make you take am for 7 days. But if you most of the time treatment with antibiotics, most of the time we believe say within 5 7 days safe, whatever you dey treat, you don treat am finish, except now very overwhelming case. Very overwhelming case. Even some overwhelming case sef, within 7 to 2 weeks sef, you don get yourself again. You don get yourself again. So I think that's the reason your doctor said you should take it for 7 days, because you know say na that time you don complete the work by that 7 days. Make you not go overtake am, come go kill all the other bacteria, all the good bacteria wey dey inside body. You can't go kill am and come cause another problem for yourself.
Someone said he read an article and it was mentioned that excessive intake of antibiotics reduces sperm count. How true is that, doc?
Okay, the person read that for articles, and the first thing is we go want know which kind of article be that, because many articles dey Google and many articles dey everywhere. Yeah, so I will not want to say too many things about that, because me never read something like that, and I no go want to say that person wrong, because if I have read it, I feel talk something put say it's right or it's wrong. So I will leave and say, because I never read that, maybe na updated knowledge when me not know. When me not know. However, I know say when you to take antibiotics, wetin antibiotics go do is that all the good bacteria wey dey your body, because we get one wey they call good bacteria wey dey person body, the antibiotics go kill all those ones. And if you kill all those ones, because all those ones still dey help us in one way, e still dey help us dey fight bad bacteria when they call enter person body. So when you don't use antibiotics, but antibiotics not no good, you not no bad, they kill all of them. So when you don't use antibiotics, they kill both the good ones come on, it go can't give room for those bad ones to enter person body. And those bad ones, if it be say the place where the antibiotics go kill the the good bacteria come on now around the sperm area. So when the bad bacteria come now, it go affect the sperm, and that can actually lead to reduce sperm count. However, as I earlier said, I not go dispute the fact if that word with the person will read that if not true or not lie. Except me go do research and find out if anything I see, by God's grace, we go let you know. We go
Yeah,
let you
yeah,
know.
yeah, yeah. We keep our mind open. So nobody say we go just come tell you saying a lie and be not true. We keep our mind open. So if it be true, if not from medical publications, if it be lie. But when we do our own research, we see the same journal, the same write up. If we can't tell you, a lot of things they online, many things. So we need to be careful. We could not just talk saying a lie, and be not true. That is why. It says, even me, doctors gave it to me in Europe. Here, they said after 6 days I should stop. And if your doctor tell you, say, after 6 days, make you stop the medicine, follow your doctor advice. And your doctor know why he say he believes, say, by the sixth day, you go done day okay. So you get why your doctor tell you like that. And we don't go come here to cancel your doctor's prescription. This is not the place. This is not the place. This platform does not have any authorization to cancel any medical doctor's prescription. Here now to just teach you and encourage you to speak with your doctor. Sure you get. Yep. Good evening. Please, what's the best drug to treat infection? Dr. Israel, want to respond to this?
No.
Okay. Okay, let me respond. What's your name? Long Hills. Please, my guy, I don't know if you are a new follower on this page. For those who they follow us newly for this page, this question is the wrong question to ask us on this platform. We go beg you, never ever work out for social media. They ask for medicine for your problem. They will give you medicine, they will kill you. I know they bend my mouth talk am. If you get a medical problem, go and see a medical doctor at the hospital or consult with a doctor privately. The habit of moving around on the internet asking for medicine for a problem, make them prescribe for you. For the fact that we are medical doctors and we have our medical license does not give us the right to prescribe medicines like this. We have a license, we have ethics, we are guided by law, and it's totally unacceptable. It's not right to do this. Nobody say we no one help you, but what you they do now wrong thing, and if it costs you your life, that is why we dey tell you say go see doctor. So usually just tell you see make we no ignore you. Now make we dey break them down like this. But next time, if you ask this kind of thing, we go ignore you. Social media is not the place to seek for treatment. Nobody fit come here can't tell us otherwise. Nobody fit come tell us say we do the wrong thing. We dey beg you to save your own life. Please go and have a private consultation with your doctor. So they go check you, they go do tests for you if there's a need, and they will prescribe for you. Thank you. Okay, for Israel, we have a comment here. We are about rounding up. How often can one take blood tonic? Did you hear me? Okay. I guess Dr. Israel's network is acting up. There is no specific time to tell you that this is when you should take blood tonic. You should only take blood tonic when there is a need. And wetin be the need? When your blood go down. If you no get anemia, listen carefully. If you no get anemia, you no need blood tonic. If you no get headache, you will just go dey drink paracetamol like that. No. So blood tonic, blood supplement, blood capsule. Now, when there is a need, so let's say you get anemia, your blood go down, iron deficiency anemia, vitamin B12 anemia, and other types of anemia. Your doctor go prescribe am for you. But say you go just wake up, you don't say why I drink blood tonic. Make I go drink blood tonic now. No, it is wrong. But when there is a need, surely your doctor will give them to you. If you want to take multivitamins, maybe vitamin C, you can take that. Maybe, you're severely stressed. Maybe, I advise you rest, take water, take fruits. And if you want to do that, fine, you can. But say you go just wake up, can't go they drink blood tonic because all my friends they drink blood tonic. Make I follow them go drink them. No, it is wrong. Is that okay? Okay, any more questions here for us? Any more? Chukuma Christabel. This name be like say one ring the bell, but I don't think I can remember. Oh yeah, let us go. Drop your comment, drop your questions, drop your comments, drop your questions here. May we go. I hope we don't break them down. For those of us where they try We dey try ask us questions on antibiotics and blood tonic. I hope we don't break them down for you. Hmm? Yes, yes. Okay. I noticed say your network been the act up. Okay. Oh
Yeah,
yeah.
call
Oh.
enter.
Okay, okay. Any more questions? Any more? Ask now. The funny thing they say when we get this kind of platform for questions and answer, we no go see the questions like this on this stuff. When we don't finish, at that time some people go come they drop questions. No vex. The live session don't end by that time, and we no go fit the response to your questions. Or you can't go they send private chat messages. No vex. We know they do private chats. We get some kind of boundaries. Now make so if you did here now and you get questions for us, I beg go ask us right now. Um okay, we got a comment here. Many thanks. All my questions were answered in the simplest form. Thank you very much. Okay. Thank you very much. Very, very clear. Thank you so much. We appreciate you. Okay, okay, Israel. Any final words as we round up tonight?
Okay. What I go talk now? We say Nandua, when I thank you for always coming to join us. One thing when I go notice now, we say we dey always talk two things. I think it's two things. One, go speak with your doctor. We never one day make diagnostics for you, and we dey try to make sure say we never mention name of drug, even to the simplest drug. Because today itself, we for even fit mention like one or two drug name, but even to the simplest drug, we still not we dey try not to mention am for this place. This one na because all wetin we dey do for here na just to educate una. We know we get the license and everything, but the license not still tell us say because we get the license, anywhere you see crowd, just tell them any drug. No, because we know say when we start doing that, we are abusing that privilege of having the license. So make una not think say we be wicked people or we not like to. No, in fact, wetin we dey do here is the best. I think it's the best thing you can give to anybody, and this is giving information. And this one na one of the patient's rights, and giving them information. So now we dey do, we dey give them information so that when una reach hospital or reach every other place, una don already harm una self with information and you know the right thing to do. I go tell you say since when we dey do this program, I can actually say get some persons around me when because of this program, they even dey use our terms take dey talk to other people to make sure say them too not do the wrong thing. So una dey do well, una do well, you do well. Dr. Fred, you are trying. You when you take the even start before I come join. And to say a very big thank you to my guy, Dr. Fred, and to everybody when they join us. Thank you so much for making these doctors ask the doctors to continue for how many years now we don't go now on power and make us still day. Wanna thank you.
Thank you so much, Dr. Israel. Thank you very, very much. And to everybody where they join us, we know they take your presence here for granted at all. Our goal on this platform now to provide health information as simple as ABC. If you notice, we know they use big, big medical grammar to impress anybody or to prove to you, say we know book. That is not our goal here. Our goal now to give you the information. We will make them simple for you, even babies, to understand. And one thing we beg people, they say we notice say social media now a very big market, and if you know they careful, you go fall into the hands of people who won't chop you, and they go chop you. I mean now, they go chop you without mercy. And after they don't chop you finish, you go come they cry, they look for help, and really no, we no be NGO, you know, right? We don't get any funding. Our job here is just to teach you. So they beg you, please and please and please, stay very careful with how you they take your health and with the way you they collect information on social media. They very careful. We have so many good doctors. Yes, so many good medical doctors are on social media educating people. At the same time, we get people where they're supposed to tie up and lock up, but then they social media too, they give rubbish information. I don't see few of them, and it's not in my place to call anybody out. So my job and our job here now to beg you, this life now one. Like I always tell you, good life now waiting, good life now sense. So be very careful. Thank you so much for always coming here. We appreciate you. God bless you, and we'll meet you here again, same time on Sunday, 8 p.m. West African time. During the week, I can be
PM.
online. Hmm? Sorry, PM. Sorry, 8 p.m. No verse. 8 o'clock in the evening, in case you understand that one. Yes. Okay. Thank you, everybody. Take care of yourself and have a wonderful evening. Au revoir. Bye bye. Bye bye. Bye bye. Bye bye. Thank you. Thank you. Thank you.